Good evening, everyone. I hope you can listen and you can see me. Please, if anyone is here, can just click a thumbs up or like so that I can know that you are here. Uh, Good evening and welcome, everyone. So today our Facebook Live session I am doing here. We came with the chapter of palliative. That is a very important chapter of your part 1 MRCPCH and also part 2 MRCPCH, and also it will be helpful in your clinical exam because in some sort of palliation will come in front of you in different scenario. Thank you, Dr. Ruxana. Thank you very much. Welcome everyone once again. Let us start our today's session, that is palliative chapter. Okay, walaikum assalam. Yes, first of all, I like to tell you that what is the importance of palliative care, and how can we define palliative care. So palliative care means when a patient is in terminal illness and suppose we cannot give him optimum comfort by treatment. So the treatment we will give him for the comfort of the patient, that is called palliative care. It is not a curative care. Okay, this is not a like we are not curing our patient. We are not giving any specific treatment like terminal cancer or like mitochondrial cytopathy or like Miller-Smurf syndrome, which have actually no treatment. Okay, so in those patients we will try to give comfort. This is our goal. Also, the definition, according to the definition, we will see that palliative care may be defined as it is a combined treatment. It is a combined care. It will increase the quality rather than the duration of life. So this is the main theme of palliative care, that it will improve our quality of life, not our duration of life. Okay, because think about ourselves. If I am going to die now within few days, what I want from life? I want my family members to be with me. This is a part of palliative care. I want to visit or see some place. Okay, if I can't go, I can see by video or picture. Why this is? Because this is my last wish. Okay, now some people want to die at home. Okay, so this is their terminal wish, and during death or at the time when the death is coming, there are certain physical problems like respiratory distress, secretions, convulsions, pain. So we have to give care to those patients. That is called palliative care. Now I hope palliative care is clear. Okay, if you have any query, please give a question below. I can see your question. There are some questions I can see. So palliative care is a combined treatment facility. It contains a multidisciplinary team like there will be a pediatrician, there will be a physiotherapist, there will be a nurse involved, there will be a pain relieving doctors who are specialists in palliative pain management. There will be some surgeon involved if some palliative patient needs some gastrostomy or some surgery. So it is a group of doctors. Also, there are some other groups of doctors, other groups of persons who are not actually doctors, like hospital chaplain, hospice care. They are not doctors. They are the other personalities that will help a terminally ill patient and their families. So I will come step by step. Just inspire me by your presence here. Okay, give likes or thumbs ups or give any comment you are seeing this, from which country you are, if you have any question regarding palliative care or MRCPCH. Okay, just show me your presence so that I can continue my journey. Okay, now what are the components of palliative care? Now, palliative care, I always tell palliative care is an umbrella. It's just like an umbrella. I always tell my students, my colleagues, that palliative care is basically a umbrella care. Among this umbrella, there are different spikes of umbrella. So there are different sections. One section contains advanced care plan, okay, and one section contains symptomatic management plan. One section contain end of life care. Okay, so this planning, these different sections of palliative care, okay, we will discuss today. This is our topic today. So in the palliative care, I already told you there are many personalities involved, like some doctors who are specialists in pain management. Now, what are the main symptoms or main problems a child may face during his or her terminal time, during his or her end of life time? So suppose a patient, a child who is stage 4 metastatic cancer, who has no hope. I mean, repeated chemotherapy failed, radiation failed, and there is a lot of suffering the child is having. So the family and the doctors, they all are in a line. They all are agree that now this child needs palliative care, because this child is suffering from pain, from many symptoms, secretion, from bleeding. Okay, so we need to give palliative care. Now, in the palliative care, there will be many plans that will be involved, like how we will reduce pain, how we will reduce any symptom, secretion. Okay, suppose any patient who is going to die in few days. Okay, so in this palliative care, in this few days, what is our duty? Our duty to give him comfort, to increase the quality of life, not the quantity. Okay, so we will try to reduce the pain, we will try to reduce secretion, we will try to reduce any disability. Okay, palliative care may need sometimes severe management, like suppose any child who is under palliative care but cannot feed. Okay, survival chance is 50-50. He can survive or cannot, may survive, may not. So in that case, we need a gastrostomy tube. So doctors will weigh the risk and benefit ratio, that is this gastrostomy tube really necessary for this child? Now the surgeon, pediatric surgeon, will be involved. Okay, so this is the surgeon, role of surgeon in palliative care. Now one doctor is asking that is the IV morphine is in palliative care? Yes, of course. If surgery is needed, so why not IV morphine? IV morphine is the optimum management of pain, and we will try to give optimum management. Okay, I will come the pain score now after one by one. Okay, so this is our role about palliative care. Okay, my friend is here. Hello there. Okay, so this now this pain symptom, as we are talking, that pain is very important symptom in our palliative care. So what is the pain score? How you know the child is actually in pain? So I am sure that you all have seen the pain ladder. Pain ladder, that is step 1, step 2, step 3, like this. There is a pain ladder, and there is a WHO pain classification, pain phases. This is called pain phases. Means what? Suppose a child is in pain but he is smiling, then grading 1 2, not more than that. A child is in pain and he is like oof, like this, so this is below 6. This is below 6. Now a child is crying severely, he doesn't let you touch, he's not letting you touch, doesn't. In that pain, it is more than 6. And a child is in severe pain, this is 8. So 8 to 10 is severe pain. In that case, we will use IV morphine, and it is a part of palliative care. Okay, so according to the pain ladder, stage 1 2, we will give only oral paracetamol, ibuprofen, NSAID, like this. Step 2, moderate, mild to moderate. In those cases, we can give other varieties of NSAID, and also we can give morphine orally. And then stage 3. Stage 3, we will give IV or subcutaneous and continuous. We can give immediate release, we can give modified release, we can give continuous release. There are different preparations of morphine. Now regarding morphine, one important point, always remember that morphine is very important for MRCPCH, also for England. Like when you are dealing with an emergency patient, when you are dealing with ER, you are having rotation duty in ER, you will face